I'm Lila Lazarus. Wherever you go, wherever you walk, you're always near somebody in pain. If it isn't you, it could be the person next to you. 100 million Americans struggle with pain every day.
It was like pins and needles being stabbed in my leg.
A silent illness ruining lives.
It hurt so bad, I'd rather, been dead. It hurt that bad.
It affects everybody around them. People scatter, relationships change.
Headache, neck pain, shoulder pain, spine pain. There are literally thousands and thousands of patients in Southeast Michigan suffering from different pain conditions.
Lots of joint pain, back pain, abdominal pains, pain throughout their body.
Pain causes depression, isolation, fear.
People lose their jobs, they lose their families. They might start drinking alcohol heavily, which takes its toll. For some people, their lives fall apart.
Fear of addiction is a big problem, and actual addiction is a problem.
And back pain is one of the most common health complaints around.
8 out of 10 adults will experience low back pain at some point in their life.
Sure, it's more common in people over 40, but back pain can happen to anyone.
I'm a 21-year-old kid, wants to do everything, but I can't.
Back pain can be the result of too little exercise, or in some cases, too much.
You're afraid that if you move, it's going to hurt, and you're afraid if you don't move, you're going to be disabled, and it can be really difficult for patients in pain.
People want help, but don't know where to begin, so they suffer, feeling hopeless.
It is the #1 disabling condition that causes people to miss work. It is very challenging to diagnose and to treat, causing a lot of suffering and difficulty.
Whether or not you're in pain, you know someone who is, someone desperate to discover relief. There is hope. Hear now the story of 2 patients with back-breaking pain and the remarkable doctors who get them through it.
Here for you, we're gonna make it through together. You and I will find our way.
These are the real stories of the patients, medical, and support teams of St. Joseph Mercy Health System, whose lives intersect for a brief moment in time to achieve remarkable outcomes.
We bring hope, we bring love, we bring our strength, and all we're made of. You and I, together.
James Hughes is only 21.
Yeah.
But his back pain makes him feel decades older.
Hi guys, Dr. Tocco-Bradley from anesthesia. Are you Mr. James Hughes?
That is me.
I see that you actually were here a couple years ago.
James has had 2 different types of disc herniations. What James had when he first herniated was a central, but really large. It was a huge disc herniation, filling the whole space, compressing the nerves.
Are you taking any pain medicine right now at home, James?
Yeah, Vicodin.
Vicodin? Okay, how many are you taking a day?
I do 2 a day, 1 in the morning and 1 in the late afternoon.
I'm sorry you're back, but we'll take good care of you.
Ted McCalco will tell you pain is his middle name.
Morning, team. We got Ted all set to go?
Yep.
Ted, you're going to start feeling that sedation here in just a minute, okay?
I was in heating and cooling. I was the guy that showed up early every day.
You fell off a ladder?
Yeah, just a stupid, freakish accident. It hurt so bad, I'd rather, been dead.
Just to know somebody's in that much pain, it just killed me.
The pain was like somebody's taking your body and twisting it.
The pain that ruins people's lives is the chronic pain, the pain that never goes away.
Basketball seemed to be the great attraction for both of our kids. They both started playing basketball when they were in the 3rd grade.
Girls still got it.
We have been following them through all of their tournaments, and it's just been a great deal of fun.
Where this all started really was in high school. It starts in my back and it moves down into my butt, in my hip area, and then it just radiates down my leg. I decided to finally attend Wittenberg University. It was in Springfield, Ohio.
Pirates in the fast break will slow it down. Giese will bring it back out. Now dumps into Hughes. Hughes will go up strong. Holy cow, can you count that? I think we can. And James Hughes with another basket, and he has a chance to complete the 3-point play.
I played my freshman year, And that's when it started to get really bad. It was hard to put my socks on in the morning.
He called and he said, "Mom, I had to have one of my buddies put my socks on because I can't bend over."
It's tough. I mean, it's tough on him. It's tough on me to see him have to go through that.
It's real difficult to see him in pain.
When somebody's suffering from pain, it's not just that patient suffering, it's their family. It's the people they most love.
Pain impacts the whole family.
I wouldn't wish it upon anyone.
It's all a catch-22, you know, when you're in pain, you don't want to do nothing, you gain the weight, your back hurts, your knees hurt, every joint hurts, your arms hurt.
You gained weight. How much did you weigh?
Almost 700 pounds. To let myself down, to let my family down, that's sad.
I've never seen him cry, and I had never seen him in that much pain.
You just want to end your life even, you know, it's sad.
It was horrible, and I did not want to see him be like that.
You were living in a nursing home.
Yep.
What was that like?
It sucked.
It was the hardest thing I had to do.
My daughter wouldn't come up to see me
I was scared, too.
because I was in so much pain.
I didn't want to see him like that.
Oh, it killed me. It just killed me. Because he couldn't come with me. Come home. That was hard.
I hated seeing him like that. I just wish he could go to the mall with me, go to lunch with me and my mom.
How long were you in bed?
Good 6 months. You couldn't do nothing.
And you could see it in his eyes that he had just given up.
I had to do something, because if I didn't, I was going to die.
It is a spiral, and it's a spiral downhill. It's very difficult to break out of that.
I weighed 700 pounds. That's a lot of pounds to get over.
There were challenges when Ted first presented to us. For instance, Ted's weight actually exceeded the limit for our x-ray table. I certainly didn't want to turn him away, and Ted did want to lose weight. He eventually was able to do that with the help of a gastric bypass.
I lost 350 pounds in less than a year.
Was the pain gone?
My pain it's constant.
I got mad. Like, there's nothing that you can do for him.
You just graduated, you said, right?
Yeah, I graduated from Wittenberg University about 2 weeks ago.
James Patrick Hughes.
Yay, brother! Were you an athlete there?
Yeah.
Yeah, what were you doing?
Basketball.
This is Wallace working on the screen, and it's stolen by Hughes. Hughes is going to jam it in for two.
He is so much fun to watch on the basketball court.
I played my freshman year, and that's when it started to get really bad. And that's when we were referred to Dr.Bradley.
This is James's MRI, and this is an MRI of his low back. He had an absolutely huge disc herniation.
We've been through a lot of injuries, but this one scared us to death.
When it's that large a herniation, you need surgery. It was squeezing all the nerves.
It's a very difficult piece of news to hear from a doctor that your son, who is 18 years old, is going to have surgery.
The saddest part is probably not being able to play basketball.
It's like the only thing you can't do for them is take that pain away. It's hard.
The last thing a parent wants is their child to have surgery, and to be honest, the last thing anybody wants is to have back surgery.
I recovered great from it. Dr. Bradley he did excellent. My physical therapists were great. I made 100% recovery.
He's just an awesome individual and a great surgeon.
Have you ever been in pain?
I herniated a disc between college and medical school, and it was terrible. It was shuddering pain. Whether someone doesn't look like they're in pain or they look horrible, I'm sympathetic to their experience and what they're feeling.
He always looked to me that he was looking at James Patrick as one of his sons. And that was very nice.
I played my junior year of basketball at Wittenberg University.
The game started and he started playing and he was scoring and he was really involved.
And towards the end of the season, it started coming back, but it was a different spot.
Something happened and he knew something was wrong.
So we got an MRI and the results showed that I had another herniated disc. Just one disc lower.
Just to see him have to go through this pain again was just devastating.
I'm a 21-year-old kid, wants to do everything, but I can't.
We're at the point now where he can't continue with the pain that he's going through now.
It's really hard because it's been right there for, what, 3 years, 2-3 years. It's the strength and courage he has shown.
Did you get to finish out the season?
I played 2 seasons. And then my senior year, I didn't get to play just because I had this injury.
I'm sorry to hear that.
Thank you.
Seems to be a risk of the profession.
Dr. Rosalie Tocco-Bradley is an anesthesiologist and pain specialist at St. Joe.
Well, we're going to take good care of you today.
She knows all too well about sports injuries and pain.
I'm married to a physician who was a healthy, strapping, young man until he sustained a cervical spine injury playing hockey.
In 2010, I was playing ice hockey and I inadvertently took a knee to the face, snapped my head back, pinched my spinal cord like you would a garden hose, and kinked the blood supply. So what I've ended up with is a large stroke.
It's a type of pain that involves burning and numbness in his arms and legs.
There's no medication to take it away.
Brian, would you like some yogurt shake?
She visited me every day when I was in the hospital for 9 weeks. It was the brightest part of my day when I saw her come bursting into my room.
You're a pain physician, so was it easy to adjust to a husband in pain?
You would think so, but the answer is no. He needed to learn to walk again, to use his hands, his arms. He has been left with neuropathic pain.
Yeah, she understands.
Finding a doctor who understands your pain is key.
Dr. Bradley.
Whole family. Hi. How you doing?
Good to see you again. Dr. Bradley has been great. He's very friendly. I remember one time he gave us his personal cell phone number to call him.
Small incision, and kind of hurt a little bit.
Yeah.
In the back, and hopefully your leg feels better.
I have 100% trust in him. Last surgery went excellent, so I feel the same about this surgery.
They said they had 100% faith in you.
I appreciate that. I try hard. I tell them that when I see them.
How'd you finally get rid of the pain?
I found the right doctors.
Tell me about your pain. Where does it start and where does it go? St. Joe's has a mission of caring for everybody. It's a very caring environment, which is why I've been here 22 years.
What did the doctors at St. Joe's do for you?
They gave me my life back, basically.
Can you pull these toes back for me on this side too? Bend this knee up for me, Ted. Okay.
When we come back, what treatment works for Ted's excruciating pain?
Happy days are coming. You feeling that?
Hugs and kisses now, please. Yep, this is the time.
The first surgery worked for James. Will his second surgery be as successful?
All right, folks. He'll see you in just a little while, folks, okay?
Plus, his surgeon's interesting hobby.
He'll keep us in line, don't worry.
When Discover Remarkable at the Heart of Medicine returns.
I came to St. Joe's 18 years ago. I actually came because I really like the Ann Arbor area and this practice. I'm married and I have 3 boys. We have a great community life here.
My dad's name is Jason Bradley. He is a brain and spine surgeon at St. Joseph's Mercy Hospital.
He's pretty nice. Sometimes, but
Morning.
Many people are afraid to come see a surgeon because they're afraid you're just going to do surgery.
I will agree. It is scary to come see a back surgeon.
Are you scary?
I think my kids sometimes think I'm scary, but I have to lay down the law at times. This is my family. My wife, Terry, my middle son, Aaron, my youngest son, Max, who thinks he's the oldest, and my oldest son, Sam. And we're one big happy family.
He tends to crack a lot of jokes. So.
Yeah.
Can you put bubbles in mine?
He might be like that stern doctor with the scrubs on. Behind the scenes, he's a jokester and he'll make silly, teenage-ish jokes.
My life is being filmed now.
I know that he's a good listener.
Morning. How are you?
Good.
I think that's probably the key to really helping people is being able to listen to them and really hear what's going on.
That's pretty nice when the wife says he's a good listener.
He really is.
Try.
Any other things about him that people might be surprised by?
he does ham radio.
There you go.
Yeah.
This is one of my favorite hobbies, is amateur radio.
It's definitely nerdy. You know he's not on the right frequency when you can hear his voice saying
Whiskey
Alpha,
Tango
Whiskey
8 United.
Yeah.
Some people might think that's a little nerdy.
It is nerdy, but it's fun, and you can talk to people all over the world, and you hear what's going on. I became a neurosurgeon because my father was a neurosurgeon and he was my idol. Back then, you were able to follow him around the hospital and nobody asked questions and there were no HIPAA violations and there was nothing. So I got to, as a kid, follow him around, watch operations, see patients in the ICU, got to see the kind of research he did in the laboratory, and I thought it was fascinating.
Your grandfather was a neurosurgeon. Your dad's a neurosurgeon. Are you guys going to be neurosurgeons?
Maybe.
Nope. I'm not.
No. These are his vertebrae and the disc that's herniated, and the one that's herniated is this material that's pooching out. That's what I have to take out right there. James is going to do well.
I'm anxious for James Patrick to be out of pain. That's the most important part for us.
Just has a little bit of a bad back.
It's hard. I would take his pain, totally take his pain from him if I could.
He wants to get better. Ultimately, I think he'll do great. Okay.
He's so brave and he's been so tough.
It's extremely hard.
He's the best. He's the best.
Good morning, Ted. You know, it always puts a smile on my face when I see you. A little bit thinner every time. When I met Ted, he was at an all-time low, from what his wife tells me. And she was there with him at every appointment, encouraging, hoping, helping. But Ted had no hope. Ted, this is the consent form, which says you're going to have a lumbar epidural interlaminar injection. We're going to go to the right side of that lumbar epidural space because that's where the area is, L5S1. I'm going to use some steroid and local anesthetic. If you don't have any questions, I need you to sign right down there.
Thanks. I love it when he gets these shots because when we leave, he's completely painless, free of pain.
Ted has degenerative arthritis, especially notable in his lumbar spine. We do an injection for Ted at L5S1, and I do an interlaminar injection with an epidural needle. This is done under X-ray fluoroscopy because I want to visualize exactly where I am in Ted so that I can correlate my needle to where I know he has the greatest problem with his pain.
When she finds the right spot, you can just feel it going in, and it's like, oh, what a relief. It's perfect.
She's amazing, just amazing. Okay, see you in a bit.
Goodbye.
Happy times are ahead.
It's called microdiscectomy. It's been done for decades and decades and decades. Microscopes get better, incisions get smaller, the imaging gets better. You can localize, go right where you need to go. Yep, right on target. So I need to open up, make a little window. I'll take out a piece of bone, take out ligament, and I'll see the nerve. And usually what I'll do is I'll move the nerve over. You'll see the little herniated piece, and then I'll take that out. Sometimes the discs are a challenge to get out.
You can actually see the disc's herniation removed.
All right, Ted, you doing all right? You're going to start feeling that sedation here in just a minute, okay? You're going to feel just a little tiny pick and burn, all right? Little pick. It's been a great, great intervention for Ted. The steroid brings his pain down, and for 2 months, he's like a new man. Now, you might say, gosh, it doesn't cure him. Well, you know, we can't make degenerative arthritis go away, but we can certainly control it and bring it to a point where there's other things you can do with your activity and your diet. You're doing great, Ted. Lots of pressure now, lots of pressure. We're very close. I'm in the ligamentum.
James' surgery is over.
And that's it. Close it up. All right, off to talk to the family.
Ted, I'm almost finished here. Medication's going in.
Ted's injection is in.
Happy days are coming. You feeling that? We're all done. That's it, Ted.
All done. Yeah, it went really well. It's all on.
Can I give you a hug?
Sure. All done. There was a pebble beneath the nerve root, so I just exposed the nerve root, and all I did is tease the membrane, and it just kind of went, and it erupted out. On to more business.
More business.
Thank
you very much.
Yep.
It's just amazing that it feels so good after the shot. And some people say it takes a week, but it takes me instantly.
But will Ted be able to walk?
There were extra challenges with Ted, but you weren't giving up on him.
I don't give up on anybody. Ask my children. How can you give up on a patient? If I give up on him, where does he go from here?
As for James,
I can't wait to take you on in basketball.
I know, it's gonna be fun.
I think I can take you.
Yeah, we'll see about that.
I'm a physician, but I have to tell you, the greatest job in this world that I have is being a mom and a wife. You look a little stiff today. You think you're going to be able to get on the bike? With Brian's injury, we needed to figure out what sort of activities we could do. Oh, my tires feel good. This is perfect. We don't even have to pump them. Are you ready?
Getting on the bike that's hard, but once I get going, I should be good.
This is the highlight of my day. I am like so happy to come home and go for a ride. The day we realized he could start to balance on a bike again was a great day.
I don't think that there's another one like her, for sure.
All right, here we go. Last hill on the ride.
I'm very fortunate to have her be my play partner in life.
It's a good feeling knowing that a week out of surgery I can be sitting here talking to you, not just laying in bed.
So how you feeling?
I'm a little sore, but I'm not too bad.
You're looking pretty good.
I feel good. It feels nice to be able to walk again.
Can you imagine life without pain?
Not right now. It's gonna be tough, but I'm ready for it.
I'm glad he's doing well. Saw him yesterday.
It's starting to heal up really nice. Oh, Dr.Bradley's awesome. He just called me the other day. I'm personal phone on Saturday. He's just been great, always checking in on me.
I always check on people. I want to make sure they're happy and comfortable.
You even gave him your cell phone number.
Yeah. If someone is willing to come to me and let me invade their body, especially on a back or a brain operation, I mean, that's a trust that they have. Could you stand more upright?
I would say so.
In a way, it's an honor for me when someone says, would you help me and operate? You have to have a soft landing. I showed your husband yesterday after surgery. I said,
Yes.
you just cannot just fall in a chair like that. I care about each and every one. As I go through clinic, I look at everybody individual and I try to listen to them. That's the key. When you listen, then they know you care.
I'll tell you, for the people who don't think there's relief, they need to find the right doctor.
If you only need a shot twice a year, I'm very happy with that.
I found the right doctors, and they're great. I wouldn't change my doctors for anything. They're just that good.
Every one of my partners at St. Joseph Mercy Hospital in pain management is board certified in pain management and provides a multitude of procedures.
Good. We're connected with a lot of different physicians here, so we have the full spectrum of non-surgical care and surgical care.
Please tell your primary care doctor that you're in pain. There are interventions we can do immediately. Extend backward. Perfect.
We have specific pain physicians that we can send patients to. We all communicate, and we're all fairly close.
You go find the right doctor, which I've found, which is Tocco-Bradley.
The first thing I said to Ted is, don't give up, Ted. There are things we can do. We're going to work together and we're going to figure this out.
They started injecting me, and that's the only thing that's helped me.
I don't think it's realistic to ever believe that I'm going to cure somebody entirely of their pain, but what I tell patients is, I think we can bring your pain from here to here.
I can feel it when she hits the right spot. It's instant relief. It's like heaven. She sets you straight. There's hope for people. I'm a perfect example because I got my life back. It was cool.
Can you walk the dog through the woods?
Well, the dogs kind of walk me.
Want to go for a walk?
I can't do much, but at least I can walk. I can walk again. That's great. People think walking isn't a big deal, but when you can't walk, it's great. St. Joe's helped me out a lot. They've not only helped me, they've taught me how to deal with a lot of pain too. They're excellent. Look, I can walk.
Now he leaves my clinic and goes to the mall and walks for 2 hours.
Shopping is like, whoa. Where is he at? Where did he go? Like, he's hauling everywhere he goes now. It's awesome. Me and my mom both have to tell him, slow down.
Sometimes he can outwalk me. And it's like, this is not right.
Well, that says it all. It's great.
I'm pretty happy right now. It's just a great feeling to not be in pain anymore. Right now, it feels good to feel a little burn in your muscles, get a little sweat going. I haven't had that feeling in a while. That pain's just gone. The surgery really took care of it, and it feels great.
You look like a completely different person.
I really am, you know. Lost 20 pounds, I've been eating healthy. feeling great, no pain. It's definitely a big relief. I'm ready to get on with my life.
There is relief when people are in pain, right?
You can make people better. You can make them feel better.
Ted and James have their lives back, no longer ruled by pain. If you or someone you know is suffering with back pain, don't suffer alone. Where do you start?
First thing they should do is seek help with their primary care physician. Their primary care physician is now very in tune to pain, and their primary care physician can help direct them to the right sources.
It's a tremendous amount of pain out there, but the message for everybody to know is we can help. As primary care physicians, we have the ability to treat your pain, diagnose why it's happening, and then treat that cause.
At St. Joe's, you'll find providers who can really connect with you, who can help you get their care at the right time, can help to diagnose your problem, can help you get restored and live again.
Treatment may be as simple as physical therapy or even acupuncture.
Surgery is absolutely the last intervention we want for anybody in pain.
Always make somebody better, especially someone who's willing and wants to get better. And if someone has the want to get better and they're open to treatment, you can get them better.
You can discover relief. It takes a plan. It takes the right doctor at the right time. If you or someone you know is suffering, call 855-SJ-DISCOVER or go to stjoeshealth.org. I'm Lila Lazarus. Thanks for watching.
Here, put your finger out.
Wow!